Hey folks, Dr. Joe here. So glad you could spend a little time with me today. And this week, every week, it's so funny. Been in practice for almost 34 years now. And we always seem to go in spurts. Like we'll have right leg pain, and I'll have left leg pain, I'll have shoulder pain. And these past couple of weeks, we've had a bunch of fibromyalgia patients come in and a bunch of chronic pain patients. Now, I'm a chiropractor. If you're first tuning in, I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition. This show that you're hearing is the #1 health and wellness radio show in the country, I guess in the world. I don't know you to judge that, but because of you the listeners, have made it this way. And what we're talking about, what I always talk about, is things that come in my offices week to week, and a lot of chronic pain patients. And for a while, we were on a big roll of stomach issues, and we still got a ton of stomach patients: acid reflux, heartburn, burping. But I want to talk about chronic pain patients today. What is a chronic pain patient? What does that mean? What do you do about it? What happens when you're the chronic pain patient? And that's a big issue, because acute means, if we're using the terms, the colloquialisms, acute means it hurts really bad. Chronic means it's been there for a long time. The actual definitions are a little different, but we're going to use those definitions today. Acute means it's really bad pain. Chronic means it's been there for a long time. So you can be acute chronic, I guess, by using colloquialisms. And about 10 million people in the United States suffer from something called fibromyalgia. Now, a lot of people have this where just everything hurts. Anybody like that? Raise your hands. A lot of you out there. I know you are, because you come to my offices. And just everything hurts. My neck, my shoulder, my elbows, my wrist, my hips, and it just hurt all the time. And it's a syndrome characterized by chronic widespread pain, sleep disturbances, fatigue, psychological distress is often a result. And of the 10 million people that are involved, about 75 to 90% are women, according to the National Fibromyalgia Association. So I've had women come into my office, and men talk about their women and say, "Doc, I think she's crazy. I think she's just looking for attention." Well, that could happen. I'm not saying that's not happening out there. But we see so much that people have these chronic pain patient cases, and people don't know what to do about them. So that's what we're going to talk about today. People with fibro, often you test healthy according to typical medical procedures. It takes about an average of 5 years for a person to be correctly diagnosed, and there's no lab test that can really detect it fully. So what we're doing is looking for manual tender trigger points, where there's certain points you push on the shoulders, the elbows, and you say, "Oh, it hurts here, 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 and here." And okay, now we can say it's fibromyalgia. But not just fibro. I'm talking about all chronic pain patients today. How many people have neck pain? Raise your hands. How many people have headaches? Raise your hands. A lot of you, right? Back pain, shoulder pain, numbness, tingling. Does it affect your life? What would life be like if you didn't have the pain? Because pain is exhausting. I hear that every day in my practices. "Dr. Joe, this pain is just exhausting. It's wiping me out. And then I can't sleep, which makes me more exhausted." And when you're in pain, it causes a whole series of events to occur in your body. Neurologically, your adrenal glands produce a chemical called cortisol, and cortisol can cause you to lay down fat because you're under stress, and it really becomes a big mess. So if you experience widespread pain all over your body, and with fibromyalgia in 4 quadrants of your body, 3 months or more, tenderness, there's like 11 to 18 different specific tender points. The American College of Rheumatology recently approved an effective way to diagnose it, and this is what we got. The problem with the diagnosis is this, and it happens all the time. Somebody comes in, they say, "Doc, I got diagnosed with blank." Okay. What are you going to do about it? I don't know. Just got diagnosed with it. How about arthritis? How many people out there have ever been diagnosed with arthritis of your wrist, your back, your knees? Bone on bone, you might heard of, right? Has anyone ever told you why you have that? I'm going to tell you right now. The reason you get osteoarthritis is the problem is mechanical, not chemical. So what do I mean by that? Something's out of alignment, the bones rub up against each other, and they wear out. And as they wear out, there's inflammation. And when there's inflammation, the inflammation can put pressure on the nerves, and it causes the nerves to fire, and it causes pain. So if you feel pain all over your body, you're exhausted all the time, multiple places in your body, even with slight pressure causes pain. And I've had fibro patients where we can't even adjust them. They're in so much pain, we can't even touch them. So we have to do traction on them. We have to do some gentle trigger point therapy. We use sometimes a technique called an activator, which is a little pop gun that pushes the bones back in place. And then we're going to talk about what you can do about when you have it. And that's the big problem, is diagnosing it is great. Well, what do you do about it? So widespread pain occurs on both sides of the body, both above and below the waist. It can feel like shooting pain, throbbing, twitching in the muscles. Patients often experience numbness, tingling, other neurological symptoms. It's kind of like you got everything. and nobody knows what it is. Like, it's not just sciatic pain. It's not just neuropathy. It's not just brachial plexus neuralgia. Ooh, you got everything, so probably there's something wrong with you in the head. And it can cause neurological issues. And I've had patients with fibro come in my office and say, Dr. Joe, if you can't help me, I may consider taking my own life. And that gets real serious when somebody says that. My antennas go up, and I've got to do something about that. And a lot of them, once they get better, are just thrilled. And I say, Doc, you saved my life, saved my marriage. I appreciate that. Fatigue, sleep disturbances. People with fibro have difficulty achieving restful sleep, and that's when your body heals, when you're in that deep sleep, that REM sleep. Research has proved that fibromyalgia patients experience abnormalities during stage 4 sleep, or that's a deep sleep. In short, the brains are frequently active during that time, and it makes it difficult to get an uninterrupted sleep. So a couple of these conditions, if you have these: depression or anxiety, restless leg syndrome, cold hands, neurological symptoms, chronic fatigue, irritable bowel syndrome, lupus, osteoarthritis, rheumatoid arthritis, endometriosis, post-traumatic stress disorder, headaches. A lot of those patients we see every day. No one knows for sure really what causes it. I have a theory on that. Most researchers agree that fibro is a disorder of a central processing with the neuroendocrine neurotransmitter dysregulation. You're processing input wrong. Fibromyalgia patient experiences pain amplification due to abnormal sensory processing of the central nervous system. So you're feeling pain more than the average person would. But then the question comes up, why? It's common that the pain in fibromyalgia runs in families, women more than men. Traumatic illness or injury often leads to it. But here's the statement that I like. And let me get to that in a second. Prescription drugs, including pain relievers, antidepressants, often prescribed for fibromyalgia patients, give you pain relief. It may not be your best option. Not only do they not address the cause of the problem, but increasing dosage of pain medication can actually make the problem worse. Here's a statement I want to go to break to. One of the most important factors in improving the symptoms of all pain patients is the patient must recognize the need for lifestyle adaptation. You have to stop what you're doing because that's what's causing it. We're going to talk about that and what you can do to change your lifestyle in just a second. If you have a healthcare question, I'm going to open up the phone lines, 844-44-Dr. Joe, 844-44-DRJOE. My website, drjoe.com. Lots of good information there. Lots of archived radio shows there, too. Hey, listen, don't go anywhere. Tell your friends about the show. We're going to be right back. Hey, everybody. Thanks for being here. I do appreciate you taking time out of your day. I am Dr. Joe, and we're talking today about chronic pain patients. I kind of started out with fibromyalgia. But the sentence I kind of ended before the last break really ties in to all chronic pain patients. And the quote was this. It's from a National Fibromyalgia Association. One of the most important factors in improving the symptoms of fibromyalgia, or all chronic pain patients, is for the patient to recognize the need for lifestyle adaptation. Now, what they're talking about is you just have to adapt your life. Well, you can't go out and do housework. You may have to stay home more often. You can't stay out late. You have to get sleep. You can't do caffeine. What I'm talking about is adapting your lifestyle in a healthy manner. Not to avoid things, but to do things of being proactive that can help get you well and keep you well. And I've had lots of fibro patients over the years, and I find there's a buildup of lactic acid. If you touch those points, there's certain trigger points you can touch, and it feels like crystals underneath the skin, and it is. It's actually lactic acid crystals building up. And those crystals, imagine they're little spikes, like salt. If you can imagine a grain of salt, how spiky that is, digging into the nerves. So one of the things we have to do then is flush out the system. We have to get good circulation. So most of them, if not all of the fibro patients I've ever seen, fibromyalgia patients, they all have a horrible diet. And they have clogged arteries. And when the arteries get clogged up, you can't carry blood to an area, so you can't flush out the waste products. So that becomes a big issue. Why would you want to have clogged arteries? And this is the thing that gets me when it comes to ordinary health care. And this is why I'm so happy the trend is changing. Ordinary health care says, yeah, you got fibromyalgia, here's some pain pills. Oh, pain pills made it worse. Here's some different pain pills. No one tried, well, I shouldn't say no one. Most people don't try to get to the cause of the problem. They just want to treat the symptoms. Now, not against treating the symptoms. If I have a headache, I'll take an aspirin. But then I'll find out, well, I'll take an acetaminophen, but I'll find out why I have the headache. It's almost always a pinched nerve it's always been in my life, a pinched nerve in my neck. Put the bones back in place and then look at some triggers. I can't do caffeine. Caffeine will trigger a headache for me. So don't do caffeine. So there you have to start making some lifestyle changes. Sometimes I'd like a piece of chocolate, organic dark chocolate, of course. But I can't do it because I know it's going to give me a headache. You can do things that'll open up your blood supply. How about drinking more water? How about something like nitric oxide? One of my supplements is Dr. Joe's nitric oxide support, and it's nitric oxide, and it opens up the blood vessels. And let me tell you, that stuff's amazing. When I take it, I get a burst of energy. My mind is clear. It helps circulation to all parts of your body. A lot of men now and women are start taking this as they're getting older because certain parts of their body are not getting good circulation. Keeping it clean, family show. And when you start taking the nitric oxide, bam, you get this blood supply in places you haven't had in years. And it's like, woo, I'm like a young kid again. So there's a lot of benefits to that. But again, if you're not treating the cause by taking nitric oxide, it'll help the symptoms, open up the blood supply. But you want to find out, why do I have that? Maybe I have low testosterone. Maybe I have a pinched nerve in my low back that controls my colon, reproductive organs, and bladder. Maybe it's an emotional issue. So the nitric oxide is great for increasing circulation, but it's not the end-all, be-all. It's something you want to add to a lifestyle. And a lot of chronic pain patients now are also taking the nitric oxide because it opens up the blood supply and helps flush out those waste products. All right, let's start taking some calls. If you have a question, 844-44-Dr. Joe. Got a lot more to talk about with chronic pain patients, but I don't want to leave you hanging too long. Linda, how can we make your day better?
Tell me how I can get my body to absorb the moisture that I put in it. My doctor told me it's like pouring water over a rock, and I have been diagnosed with Sjogren's. I've tried everything.
Okay.
I cannot take any of the meds.
Sure.
I'm better without them.
Okay.
But I don't sleep, and I'm a mess, and I'm falling apart, and my skin's all dry and wrinkled, and I'm a mess. I'm just totally a mess.
Right.
I don't sleep.
Right.
I feel horrible most of the time.
Okay.
I've tried everything.
The Sjogren's syndrome, it's an autoimmune disease. The body is attacking itself. We know that, and those people don't know it. That's what we're telling you. And many times you'll see dry eyes, dry mouth, fatigue, joint pain.
I have all that.
All that. Okay. So a couple of things when I have Sjogren's patients come in. Number one, I almost always find bones in the upper part of the neck out of alignment. Pinching the nerve and blood supply. Yours are. So there we go. So I'm psychic.
I had a wreck, real bad. 35 years old. I was 69.
See?
69 now.
Okay. So there you go. So now
major car wreck. Crushed my vertebrae in my neck, tore up my shoulder muscles and everything.
Okay, so now we have
my back.
Okay, so pinched nerves are a big player in this. Have you? So I would recommend, first of all, get chiropractic care and get the spine checked.
I do on occasion. Yeah.
Perfect. Okay.
I mean, for periods that I can with insurance, and then I quit because I run out.
Okay. Well, I'm going to get on my soapbox now. Don't let the insurance companies dictate your life. And that's what they're doing now. And this is
they can't afford it.
I understand that. I mean, but they're...
I've often said the one thing they should do different is to pay for part of a massage for people or a physical therapy when it helps.
I understand.
They don't.
Okay. All right, let me give you some answers now. Okay. I know you're in pain. Believe me, I've had a lot of Sjogren's patients over the years.
Yes.
Okay. Couple of things you can do for the skin. Number one is take a bath. Because if you're not absorbing it through your body, you can absorb it through the skin. Your skin is a sponge. So if you start taking baths every day, and you can add a little oil to it if you wanted to, maybe some coconut oil into the bath, and that'll start absorbing into the skin, and that'll help rehydrate the body. Then when you come out of the bath, rub some coconut oil on your body, extra virgin organic coconut oil.
I do that already.
Okay, perfect. Good.
I do all the coconut oil, the vitamin E oil, the whole 9 yards, everything on the market.
Excellent. Okay, you taking baths? Try to bath.
No, because my doctor told me with my UTIs and my swollen bladder, I can't anymore. But other than that, I take a bath. I take a good shower, put a whole bunch of oil on every day, twice a day.
Okay. Then let's start looking at nutrition. Something you got to get nutrition into the body, and if the body isn't absorbing it, many times in autoimmune diseases, you got to get in with an anti-inflammatory condition. So an anti-inflammatory diet would be no alcohol, meat, sugar, dairy, coffee, soda, or artificial sweetener. Those are the 7 inflammatory foods.
I haven't any of those.
Okay.
Except coffee once in a while, real weak.
Okay.
Other than I don't do any of that stuff.
Dr. Joe's Super Greens, Dr. Joe's Essential Source would be helpful. The nitric oxide might be helpful to increase your circulation to your body. And
I thought that sounded good.
Okay, and
I haven't tried that yet.
And get the chiropractic care. And if you can't afford it, if you call my office, we can talk a little bit about what to do about that. I don't want to say this on the air because it's something like that. Okay? Call this number, 844-44-Dr. Joe. Give us a call tomorrow. We'll talk about that, okay?
One quick thing.
All right, hurry up.
PT, physical therapy with myofascial release helps me so much more than regular physical therapy. So you might tell your people.
Okay.
Myofascial release helps so much.
Thanks, Linda. Appreciate the call.
Thank you. Thanks for your help.
All right, let's see here. Oh, we can't. Let me me see here. We got this new system. Oh, there it goes. Okay, we got our new system. All us hosts are getting confused here. So, folks, I'm Dr. Joe. If you have a question, 844-44-Dr. Joe. And we're talking about chronic pain patients. About to go to a break. So if you're on hold, Jim, keep holding. Alicia, keep holding. I'm going to get back to you as soon as the break is over. But we're talking about chronic pain patients. And the big thing, like the caller just said, pinched nerves. This is by far the number one cause of pain that we find in our offices. Neck pain, back pain, shoulder pain. It's many times the bones are out of alignment, pinching nerves. And until you put the bones back in place, you're not going to get the results that you want. And that's where the problems come in. Is so many people say, well, I'm treating the symptoms, but the cause is bones out of place. As a chiropractor, of course, we see that all day, every day. All right, got to go to break. If you want to get Dr. Joe's Super Greens and Dr. Joe's Essential Source, which you should absolutely positively be doing, by the way, that's the minimum amount of nutrients you need every single day. They taste great. drjoe.com, also available on Amazon. My books are on Amazon as well. If you have a question you don't want to get on the air, send it to me through my website, Dr. Joe, if you want to make an appointment there too. Hey, tell your friends about the show. We're going to be right back. Tell your friends about the show. Hey, folks, thanks for being here. Do appreciate you taking time out of your day to spend with us. And what we're talking about today is chronic pain patients and things that you can do to deal with chronic pain. And of course, as a chiropractor, I'm going to recommend chiropractic care because that's by far the number one reason people have pain is pinched nerves. And that's the easiest thing to fix. And you got to do what we say, by the way. I got to tell you that too, because every now and then a patient comes in and they know more than we do. And well, I don't want to do that. I don't want to do that. Okay, well then don't. I always tell patients, you can do whatever you want. It's your call what you want to do. But after 34 years, was it 7 degrees, 23 certifications, tens of thousands of patients we've seen, why don't you try it our way for once and see if it works? And the chances are it's going to. So let's talk about some things you can do, and then I'm going to get back to the caller. So Alicia and Garrett, keep holding on there. I'm going to get there. Number one, and this is the thing you have control over, eliminate processed foods and focus on a raw food diet. The more raw food you eat, the better off you're going to be. Now, there's a book called The China Study. It's one of the most comprehensive looks at how your diet impacts your health, and it found that a good diet is the most powerful weapon against disease and sickness. This is the thing that you have control over. And if you listen to my shows, you know that I push diet real hard because it's something you can control. When you cook a food above 110 degrees, I talk about this in my book, Prescription for Extreme Health. I have a chapter on this. If you cook anything above 110 degrees, you destroy something called the enzymes. Now, what the heck are enzymes? Enzymes are things that make everything else work. And when you put enzymes in your body, they can fight inflammation, which fights pain. So many times I have these chronic pain patients come see us, and they want chiropractic care. We're more than happy to do that for them. But then we do nutritional workup on them. And I tell them, listen, you're going to have to do some things like I want you to have something raw at every meal. Now, when I say raw, broccoli, cucumbers, tomatoes, avocados, salad, because the enzyme levels have to be increased in your body to help the body heal. Dr. Joe's Super Greens, Dr. Joe's Essential Source, loaded with enzymes. We even have a Dr. Joe's enzyme support. So people that are really in bad shape will go to my website, drjoe.com. We'll put them on an enzyme supplement. Now, here's how I want you to take an enzyme supplement. If you take it with food, it's going to help you digest the food. If you take it between meals on an empty stomach, the enzymes can get absorbed into your blood system and then help fight the inflammation. So something raw at every meal, and then between meals, I'd say taking Dr. Joe's enzyme support. And that can help break down the inflammation and help speed up the healing process. But again, if it's a bone out of place and you don't put the bone back in place, it's not going to give you all the results that you want. All right, let's start taking some calls. We lost one there. All right, let's see. Alicia, how can we make your day better?
Yes, Dr. Joe, I do have a question. Today I gave to my pastor one container of the super greens and one of the essential source.
Yes.
But he is diabetic. Can he still take them?
Oh, absolutely. It's perfect for diabetics because it's fruits and vegetables, and we juice it. We take the water out at a very low temperature, keeping the enzymes active, and we take the sugar out. So for a diabetic, it's like ideal for diabetics. So the answer is absolutely positively yes.
Okay, thank you so much. That was my question. I appreciate it.
Thanks, Alicia. Appreciate the call.
Thanks.
There we go. Okay. Folks, if you have a question, 844-44-Dr. Joe. What Alicia was talking about is Dr. Joe's Super Greens and Dr. Joe's Essential Source. And it's the minimum amount of nutrients you need every day. I take it every day. I have it in the studio here with me today. If I have a big day, busy day, I'll even take a double dose, maybe one in the morning, one at night. Because it's just amazing. When people start taking it, they go, Dr. Joe, why didn't I take this my whole life? This is incredible. And my answer is, I don't know. I don't know why you didn't take it your whole life. Well, you should have been. So Well, it only came out about 15 years ago, so maybe that's why. So back to raw foods. Raw foods are loaded with beneficial enzymes. Enzymes are actually, they're special protein that act like catalysts for chemical reactions that keep you alive. Now, the reason you're alive and a bag of chemicals aren't is because of enzymes, and the enzymes make everything happen. So if you destroy it above 110 degrees by cooking it, you're not going to get the enzyme reaction. Then your body has to produce enzymes to help digest the cooked food. When those enzymes can be working on things like healing and breaking down inflammation and helping with chronic pain. So your body contains about 2,500, maybe more, we're not even sure, different enzymes, and they're all important. Enzymes in your saliva, for instance, break down starches. Amylase, salivary amylase, helps break down your carbohydrates. Then you chew food. That's why it's important to chew your food. It goes down into your stomach where acids, pepsin and pepsinogen and hydrochloric acid, break down proteins. So you got carbohydrates start to break down in the mouth, proteins in the stomach. Then it passes from the stomach into the small intestine where your pancreas, boy, that's an important organ, produces amylase, protease, and lipase to break down carbohydrates, fats, and proteins. Then it passes on a little further, and your gallbladder spits out bile to help break down the fats. So each carbohydrates, proteins, and fats each have two places in your digestive system, mainly where they get broken down. So if you're not chewing your food, you're taking away one of those places. And if you're not chewing your food, if your stomach is up against your diaphragm, if you have acid reflux, heartburn, burping, gas, bloating, chronic cough, sinus problems, you're probably not digesting your proteins properly. So they're passing partially digested into the small intestine where these relatively big chunks of protein can get absorbed into the blood system. And now the immune system starts attacking these big chunks of protein. And that can lead to autoimmune conditions where the immune system just goes crazy. So most cases of autoimmune, I find a digestive component that's never been addressed. And then we get them off the hard-to-digest foods, the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. We get them on some digestive enzymes, Dr. Joe's Super Greens, Dr. Joe's Essential Source, chiropractic care, of course, to put the bones back in place. And now the body actually has a plan to heal. Because usually we're fighting our bodies. We're dumping in, the meats and the sugars and the fried foods and the candies and the cakes and the donuts and the alcohols. And the body's trying to deal with that, and it can only deal with so much. Your body can only handle so much chemical stress or physical stress or emotional stress, and then it's not able to handle anything. And that's where we have the problems. So if we have 2,500 different enzymes in your body, and you're not replacing them on a regular basis, you got a problem. So what I find, a lot of people that switch to a plant-based raw food diet, it helps their skin, it helps their mood, it helps fight chronic diseases like fibromyalgia, chronic fatigue, Crohn's disease, and even patients like cancer patients have shown amazing results in many cases when they go to a more plant-based diet. So I've been a vegan now for almost 33 years. I'm not asking you to do that. Some people consider that crazy extreme. I want you to experience extreme health. If you've never experienced extreme health, you really should try it. Let's assume I'm wrong. Do it for a while. Do it for 6 months. Do it for 1 month. See if I'm right. I am. So I tell people, get the Super Greens, the Essential Source, do it for a month. If you don't like it, well, that's okay. Don't get it again. But if you do like it, which major majority of people love it, you want to get an automatic reorder and just keep getting it because it tastes great. It's so good for you. It's off the chart. I don't know how people live without it. All right, more about chronic patients. You need to get moving. And I know that's so hard when you're in pain, but one of the worst things we can do when we're in pain is not move. So find whatever activity you can do. If you're sitting in a chair and you have to get a can of tomatoes and use it as a weight to lift your arms, do that. If you can walk. I can't run. I have an old fracture in my back and I can't run, so I walk. Love walking. So walking doesn't aggravate my pain. I can go ahead and do it. Listen to radio shows. Learn a lot about health. My website, drjoe.com, has well over 1,000 hours of archive shows, audios and videos. Our podcast is called For the Health of It, so if you have a podcast service, you can sign up for the health of it. Subscribe to our YouTube channel. We have tons of videos and audios there. I want to get this information to you any way we possibly can. Folks, got to go to break. If you have a healthcare question, 844-44-DR-JOE. My website, of course, drjoe.com. You can get the Super Greens, the Essential Source. They're also available on Amazon. Get them on Amazon. Questions, send them to me through the website. I'm more than happy to answer your questions if you can't get on the air. But now's your chance, 844-44-DR-JOE. We'll be right back. Hey, folks, Dr. Joe here. Thank you so much for spending time with us today. I do really appreciate that. Lots of callers today. I'm going to get to you callers. I'm glad you're all listening and have lots of questions. And we're talking today about pain patients, chronic pain, and what do you do about it. And I talked earlier about getting moving. And it's a good idea. Check with your chiropractor. Come see us if you're in the Atlanta area. We have offices in Marietta, Duluth, and Stockbridge. We'd love to meet with you. And just make sure that you're capable of doing certain exercises. I don't want you doing something that's going to hurt you. I've done that over the years. I think I can do that. Now as I'm getting older, it's like, I think I'm still young. Well, my brain is, but my body isn't. So you want to make sure you're able to do something that's you're capable of doing. And I was going to talk about sleep, but I got somebody here, Garrett's on the line with CPAP, so I want to answer that question. So let me start taking some questions again here. Let's see. Lee, how can we make your day better?
How you doing, Dr. Joe?
Very good, sir.
Yeah, I had a question. When it comes to eating salads, I usually eat carrots, broccoli, and spinach leaves, and a few other fruit vegetables. What dressing would be best for a salad? Because I usually like ranch dressing, but I heard sometimes it robs the nutrients out of the salad.
Absolutely, not a good idea. Yeah. Simple salad dressing is 1 part apple cider vinegar, 2 parts. I'd use extra virgin olive oil, coconut oil. I like olive oil because I'm Italian, and maybe a little bit of water, and just shake that up. And you've got a very simple salad dressing, much less expensive than buying it. Because I'm always amazed how expensive salad dressings are. In my first book, Eating Right for the Health of It, I have a whole chapter on salad dressings. It's funny you say that. But you can do a ginger salad dressing. I love ginger because ginger is anti-inflammatory, helps with pain patients. But you want to keep it really simple. And here's a rule on not just salad dressings, but everything. If you can't pronounce it, don't eat it. Okay, that's a good rule. So, oil and vinegar, raw organic apple cider vinegar is going to help alkalize your system, give you a bunch of minerals, stimulate your digestive system. So that's what I use on my salad dressing. 1 part apple cider vinegar, 2 parts olive oil, and then some water, and then I shake it up. So.
Oh, okay.
Nice
I'll surely do that from now on then.
Greatly appreciate it.
I'll surely.
Thanks for the call.
All right.
There we go. All right, let's keep taking callers. Lots of people have questions today. Brian, how can we make your day better?
Yes. Are you talking about chronic pain? I have been diagnosed with chronic pelvic pain syndrome. Are there any adjustments or recommendations that a chiropractor could make?
Oh, absolutely. Yeah, the pelvis is really important. I mean, it's the whole foundation of your spine. And if the sacrum comes out of place, the ilium comes out of place, your pubic symphysis, the bones in the front can come out of place. Pelvic pain is almost always related to a misalignment. Now, if there's an infection or a tumor, that's something different. But there's almost always a misalignment that's involved. So, yeah, it'd be a good idea to come see us and let's take a look at that.
Okay, thank you so much.
Thanks, Brian. I appreciate that. And, folks, if you do want to make an appointment in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Just go to my website, drjoe.com, and you can do that, or call 844-44-DR-JOE. The number you're calling now rings through our offices. Let's keep going on here. There's Garrett again. There you go, Garrett. Finally got you on. How can we help you today? Hello, Garrett. Maybe I don't have Garrett. Ground control to Garrett. No. Going once, going twice. I'll answer your question anyway, Garrett. So Garrett had a question about sleep and an alternative to a CPAP, which is a machine that helps people sleep. And what I find, if you can't sleep very well and you need a CPAP, every case I've ever seen, and I don't know how many hundreds and hundreds and maybe thousands I've seen over the years, your stomach sits below a sheet of muscle called your diaphragm. And if the stomach pushes up against the diaphragm, when you're standing up, gravity is pulling your diaphragm down, and you can breathe. When you lay down, the stomach pushes up against the diaphragm, so the diaphragm can't go down. It's physically being blocked. And so you can't get air in. You can't get a deep breath. So that's why a lot of folks have to sleep on an angle. How many of you sleep on a chair with a bunch of pillows underneath you because you might have acid reflux or difficulty breathing? Many times we need to just go in, massage or adjust the stomach down away from the diaphragm, and there's trigger points or muscle points we can use along the diaphragm to get it to release. Then we need to check the nerve supply to the diaphragm because many times this is what's missing. If you have a pinched nerve in your upper part of your back, that could be the nerve supply into your heart and lungs. The 4th cervical vertebrae, right in the middle of your neck, is the nerve. It's called the phrenic nerve that supplies your diaphragm. And I've had countless patients over the years that had a pinched nerve in their neck. The brain couldn't get the message to the diaphragm, especially when they're sleeping. They twist their head around, and the diaphragm can't work properly. So even though the diaphragm is down, above your belly button, kind of, the pinched nerve in your neck is the thing that controls the diaphragm, called the phrenic nerve. So pinched nerves at the 4th cervical vertebrae can be affecting the phrenic nerve, which can affect your sleep. So we check the spine. We check the stomach to see if the stomach is up against the diaphragm. We need to massage it down or adjust it, I call it adjustment, pull it away from the diaphragm. That not only helps your digestion with acid reflux and heartburn and burping and gas and bloating, but it also then allows the diaphragm to start moving again. And when we do it, so many patients, they go, wow, I can finally get a deep breath. That's amazing. So that stomach diaphragm connection, I've done countless shows on that, I think, with the vagus nerve, and the vagus nerve controls emotion. It's parasympathetic. It helps you calm down, and I can go on and on and on about that, but it's really pretty important that you get that fixed. So let's keep talking about chronic pain. If you have a question, 844-44-Dr. Joe, and I'll get to your questions in a second. I do got to cover my notes here because I said I would. And we just talk about a good night's sleep, and that's one of the reasons people can't sleep. And then this. Let's talk about this in the next 2 minutes here. Your stomach's job is to take proteins and break them into amino acids. And if you're a regular listener to the show, you've heard me say this before. The amino acid tryptophan combines with vitamin B6. That's why we take Dr. Joe's B vitamins every day, right, boys and girls, like I do? Good, I hope you do. It's on the website, drjoe.com. And I take Dr. Joe's B vitamins as one of my daily supplements. And the B6 combines with tryptophan to create a chemical called 5-HTP. 5-HTP becomes serotonin in your brain. And this is why when there's anxiety, depression, emotional disorders, ADD, ADHD, always, I've always found a digestive component that's never been treated. Then we work on that. Get them on some raw foods. Get them on Dr. Joe's Super Greens. Get them on Dr. Joe's Essential Source, the B vitamins. Pull the stomach away from the diaphragm. If they're eating a lot of cooked foods, digestive enzymes. And then the stomach is able to break the proteins into amino acids to produce tryptophan. Tryptophan becomes serotonin. Serotonin becomes melatonin. Melatonin helps you sleep. So many times you're not sleeping because of a stomach issue. Preventing proper breathing, stomach is up against diaphragm, and you're not breaking down the proteins into amino acids to produce the neurotransmitters, and so you can't go to sleep. Now, I have this issue. If I take Dr. Joe's nitric oxide support, that's a supplement I take to increase circulation to the body, I got to take it first thing in the morning, because if I take it at night, I'm wide awake. I can't sleep very well. So just a little trick. You may be different. Other people say they don't have a problem with it, but if I take it too late at night, and same thing with Super Greens and Essential Source, I just have too much energy. Folks, if you have a question, 844-44-Dr. Joe, my website to get the supplements, to my books, listen to podcasts, drjoe.com. If you'd like to make an appointment to come see us, we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge, 844-44-Dr. Joe, or just go to the website. Also available on Amazon. Our products are also on Amazon. If you have an Amazon account, it might make it a little easier for you. But we want to get you well and keep you well. Hey, do me a favor. Tell your friends about the show. Don't go anywhere. We're going to be right back. Hey, folks, thanks for being here. Do appreciate you taking time out of your day to spend with me. I am Dr. Joe Esposito, and today we're talking about chronic pain patients. Lots of callers about chronic pain, which is great. If you have a question, 844-44-Dr. Joe, because I've spent an entire life now trying to get people out of pain, but not just out of pain, but actually well. I don't want to just cover up the pain. I want to get to the cause of the pain, because sometimes covering up the pain is good, but sometimes it can have long-term side effects. So a couple more things. I'm going to get to the callers. If you have a question, 844-44-Dr. Joe. And with pain patients, I always tell them, listen to your body. Find out when you feel bad, and that may mean that you have to actually start paying attention to things. So I'll tell my chronic pain patients, or any pain patient actually, I say, I want you to start writing down everything you eat. And if you go to my website, drjoe.com, under new patient forms, we have something called a diet diary. And you can print it up. It's free. And I just want you to start writing down everything you eat. And then if you have a specific issue, whether it's pain or anxiety or sleep issues or gas, bloating, diarrhea, burping, whatever it is, write in the margin, gosh, I had the double beef cheese burrito, whatever it is, and I noticed that I couldn't sleep that night. Or my back pain flared up. Like me, I can't do caffeine. I get a headache. And so when you start writing down what you're eating, and then you start writing down your symptoms when they appear, in most cases you're blown away because you figure it out for yourself. How about that, Dr. Joe? I didn't realize that every time I do wheat, I have terrible abdominal pains. All right, well, let's cut out wheat for 10 days and see what happens. That's wheat, breads, cookies, cakes, donuts, pastas, wheat, barley, and rye, actually, because they have a protein in it called that'll irritate the bowels. And the gluten, which is in these things, and there's different types of gluten, but this is the gluten that usually irritates it, wheat, barley, and rye. Gosh, I can't do that anymore. Well, God, every time I have pizza for lunch, I'm exhausted. Well, pizza has cheese with saturated fats, clumps your red blood cells together. The gluten can cause an inflammatory reaction in your bowels that can really put a strain on your immune system. And now you're tired all the time. Well, that makes sense. So real simple homework for you to do. Go to my website, drjoe.com, print up the diet diary, and see what you find. And I think you'll be pretty much amazed what happens when you do this. And so many times you solve a lot of your own healthcare problems. Now, as chiropractors, my team of doctors, we work on bones out of place, pinching nerves. Those are the things you can't fix. If you have acid reflux, you can't adjust your own stomach. Everybody asks me, can I adjust my own stomach like you talk about on the radio? No, you can't, because if you could, I'd do it for myself, because I have the same problem. So the things you need us for, we're there for. But you can take Super Greens, an essential source. You don't need me to tell you to do that. Go to my website, drjoe.com or Amazon, and take it. It's a scoop of 2 powders. I take a scoop of each. I mix it with coconut milk, ramen milk, shake it up and drink it. Tastes great. And amazing how good most people feel. And it's pretty crazy how easy it is. And everyone says, why didn't I do this sooner? Why didn't somebody else tell me about this? And the answer is, I don't know that. But listen to your body. Notice how you feel if you start having symptoms. I can't sleep very well with my head turned to the right. It hurts my neck. I can sleep with my head turned to the left. I don't have a problem. So guess what? Don't sleep with my head to the right. So you're going to have to pay attention to your own body and actually do a little work. And consider some alternative treatments. Of course, chiropractic care is the one I recommend the most, being a chiropractor. There's breathing techniques. There's herbs and nutritional supplements, the super greens, the essential source, the adrenal support. The adrenals produce anti-inflammatories. And many people, when you're in pain, put such a strain on your adrenal glands producing the prostaglandins, the anti-inflammatories, that the adrenal glands kind of poop out. So my personal nutritional protocol every day, Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's B vitamins, Dr. Joe's Adrenal Support, and then nitric oxide periodically. I don't take it every day. Enzyme support if I eat a big, heavy meal. If I eat cooked food, I don't eat a lot of food, but if I eat a lot of cooked food, I'll have the enzymes. We have probiotics for folks that have done antibiotics in their lives, and the bacteria is kind of destroyed. The probiotics are a real good thing to add to your diet. If you have yeast infections, probably want to add some probiotics to your diet to help fight off the yeast infections. Hey, I'm going to go back to the callers, but do me a favor. Follow me on Facebook. Follow me on Instagram. Sign up for my newsletter on my website, drjoe.com. Send out a lot of good information. My podcast is called For the Health of It, which is the title of my first book, Eating Right for the Health of It. And that's on, if you have the Google Play and the other podcast services, you can go to For the Health of It and sign up there. Subscribe to my YouTube channel. We send out a lot of good information because I want to keep you informed. And when sometimes we have free lectures and there's a charge. Well, there's free lectures, but some of them they charge for because companies hire me to speak. And if there are, many times I insist you give me free tickets, and then I give it to my people that are signed up for my newsletter or follow me on Facebook and Instagram. So no reason not to do it. I mean, we don't give out your information to anyone. All right, let's start taking some more callers at 844-44-Dr. Joe. Give us a call if you have a question. Ooh, whoa, Leo. Whoop, you there, Leo? Hello, Leo.
Yeah, right here, doctor.
Okay.
Can you hear me?
Yeah, you're a little loud there.
Hey, Chris.
Go ahead.
Yes, sir. I'll lower the volume.
Okay.
Doctor, having some issues. I'm 48 years old. I'm very fit. I do a lot of workouts in my job. I'm a demolition contractor, and I tend to eat really healthy. The problem I'm having is I've gone to a couple of chiropractors. One guy kind of messed me up, I think, personally. The second guy fixed me temporarily, and now I'm having more pain. What am I doing wrong? Or what do I need to do?
Okay, well, a couple of things. Can you handle that, Ahmad? There we go. Got it? Okay, there you go. Ahmad, the amazing producer, is handling everything. A couple of things. Number one is it may take more than a few adjustments. I've had patients come in and say, well, Dr. Joe, we came in 2 or 3 times and we're not fixed yet. Well, depends how bad your situation is. So number one, you have to look at that. Number two, if you're doing a lot of work after getting an adjustment, you may be messing up the work, so to speak. So it may take longer. Because I'm not saying quit your job and sit around and do nothing, but if we put a bone back in place and you go out and do things to aggravate it, that can be an issue. And again, I don't know what these other chiropractors did. We want to look at the nutritional aspects. Are you doing things that are inflammatory? Do alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener? Do you have acid reflux? Maybe you're not digesting your food properly. So there's several things that could be players in this game here that we have to look at. And I always tell my patients, we have 5 doctors. So if one doctor you're happy with, great. If you want to try the other doctors, see which personality or which style works best for you, we have the opportunity to try that. So I wouldn't give up. I would just say we probably need to try maybe another approach to see what we can do to get this thing well.
Understood. By the way, the symptom that I was given is I've got an extra bone in my lumbar situation. I got a pinched nerve is what the doctor said.
Yeah.
And he did a couple massages. I laid off easy, and it just tends to come back, and now it's got a little bit worse than it had been. So
yeah.
I'm going to take your recommendation. Thank you so very much for your information. Love you. I think I'm going to visit you over in McDonough. Thank you so much.
That sounds great. Thank you, Leo, so much. All right, folks, if you want to make an appointment to come see us, 844-44-Dr. Joe or my website, drjoe.com. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. If you have a question right now, the lines are open, 844-44-Dr. Joe. Hey, don't go anywhere. Tell your friends about the show. We're going to be right back. Hey, folks, Dr. Joe here. Thanks for being with me. I do appreciate that. And we're talking today about chronic pain patients. And interesting studies are out on pain. And the more and more studies come out, the more and more we find that there's usually a nutritional deficiency. It's either a pinched nerve and or nutritional deficiency that is the major cause of your pain. Now, there are other problems you can have. You can have a cyst in a bone, for example, which may be benign, just a little fluid-filled cyst, and that certainly can cause pain. You can have tumor growth. You can have diabetes can cause pain. Once again, that goes back to what? Nutrition. So if we can get the bones lined up in the body, 206 bones in the body, and get the diet straightened out, and get you off the inflammatory habits that you have, even perfume and hairspray, those cause inflammation. Scented soap, scented hair, shampoos. So I know it's a couple of steps you might have to take, but this is the thing. It's so much cheaper than anything you're doing right now. It's so much easier once you learn how to do it than anything you're doing right now. And patients say sometimes, well, Dr. Joe, I can't do that. I could never change my diet as radical as yours is. That's okay. How about we make a little change? How about we cut out the donut and the bagel for breakfast in the morning, and maybe you have a fruit salad, maybe a little oatmeal, maybe some Dr. Joe's Super Greens and Dr. Joe's Essential Source. Oh, I could do that. Okay, let's see what happens. You know, Doc, I do have more energy in the morning. It's pretty amazing. All right. Now let's go to a lighter lunch instead of having pizza and meatball sandwiches, which, by the way, I'm Italian. I miss them a lot. I'm not going to lie to you. Let's go to something lighter. Oh, I could do that. Well, you know, Doc, I do feel better. And by the way, when I went to the restaurant, it was a lot cheaper to have a light dish than it was the heavy dishes. So you're saving money. You're probably going to live longer. You'll sleep better. Your love life will improve. Your pain should decrease. You'll probably lose weight. What's the downside to this? Well, the downside I can see is meatball sandwiches taste good. But so do other things, too. I was watching a show just the other day with Anthony Bourdain, God rest his soul, and he was in India. And he says, I've been eating, he says, I haven't had any animal flesh in 3 days now. He says, I'm going a little nuts. I need some animal flesh. But then he says, if all vegetarian meals tasted this good, I wouldn't be such a jerk about vegetarianism. And I thought, good statement there. So when you start finding the foods that do taste good, and it's not like the old days when I first started doing this, 30 plus years ago, it was pretty much salad 3 meals a day. And now almost every restaurant has a plant-based choice. It's kind of cool. But here's the thing that you may not know. Research suggests that vitamin D can play a role in chronic pain conditions. Now, so many people are deficient in vitamin D. A study came out in Pain Medicine. Researchers found that patients who required a narcotic pain medication, listen to this, is important, especially with the opioid epidemic we have now, and who also had inadequate levels of vitamin D were taking nearly twice as much pain medication as those who had adequate levels of vitamin D. Those patients also reported that the worst physical functioning and that they had the worst physical functioning and viewed their overall health as worse than patients who had adequate levels of the nutrient. So when you get your blood work done, especially if you're a pain patient, chances are you're getting your blood work done, make sure they check your vitamin D levels. If your vitamin D is low, sometimes some doctors will suggest vitamin D2, a prescription vitamin D. Not my favorite. Vitamin D2 has to be converted into vitamin D3, and they'll usually give you like 50,000 units a week. Well, you can only absorb so much of anything, including vitamin D. So what you want to do then is maybe take vitamin D3, which is the form that you have to have anyway, and take it every day, maybe 5,000 units a day, which is what I do. And I take vitamin D in the winter. Now, in the summer, I'm outside a lot. I like to garden. I like to hike. I like to even drive my windows open, even when it's hot. I like to get sunlight. And so if you're getting sunlight, maybe 10, 15, 20 minutes a day of sunlight, well, on your arms, your legs, your chest, your face, you probably don't need to take vitamin D in the summer. Always good to get a check, though. But if you do, I take about 5,000 units a day in the winter, and I have something called Dr. Joe's Vitamin D, and I added K2 to it, vitamin K2. Vitamin K2 is necessary for bone health. And so many people are deficient in vitamin K2, and it can help your immune system. And most people never even heard of vitamin K2. K1 helps clot your blood. K2 helps bone development. So we have Dr. Joe's liquid vitamin D3 with K2, And I take that in the winter. I take 5,000 units a day, which is 5 drops. A drop is about 1,000 units. And it's simple. It doesn't have much flavor at all. You can mix it in with your super greens and your essential source if you want to, or just take it straight up. And that's going to help tremendously if you're a pain patient. And this is published in the journals, Pain Medicine. I mean, this is not something that's weird, airy-fairy stuff. This is medical research. Many patients who have labeled with fibromyalgia are, in fact, suffering from symptomatic vitamin D inadequacy. And it's especially required to help those risk factors if you have obesity, dark pigment of the skin, or limited exposure to sunlight. So if we're bigger, we might need more. Pretty interesting. Study is positive news for the health community of patients who struggle to find more effective treatments to cure fibromyalgia and other pain patients. It does suggest that vitamin D is it doesn't suggest it's the main cause of fibromyalgia, but it could be a contributing factor that's easily rectified and relatively inexpensive. So wouldn't it stink if the reason you have so much pain, if the reason you've been a chronic pain patient for all these years is simply because you didn't take 5 drops of vitamin D every day? Many cases it is. And sometimes it's that easy, just finding out that one little thing to make it work. That's what enzymes do. Enzymes are real small. You don't need a lot of them. There's a lot of different kinds, but the enzymes make everything else work. So if you suffer from chronic pain and that requires narcotic medication, you really should be getting a blood test done for your vitamin D levels, especially if you're overweight, if you're housebound, if you have dark skin, if you don't get out in the sun a lot, and a simple thing like that. And we have vitamin D3 on my website, drjoe.com. These supplements can interact, the vitamin D supplements can interact with certain medications, such as epileptic medications, weight loss drugs. So just be careful. Check your drugs and make sure that there's no interaction. Now, here's the thing, and people say this to me all the time. I'll say, well, Dr. Joe, my supplements might interact with my medications. I like to look at it as your medications interacting with your supplements. Now, don't come off your supplements. Don't come off your medications. I'm sorry. Always check with your doctors, and the doctors can always contact me. We co-manage so many cases, hundreds of cases with other doctors, because we want to get you the best care possible. And you might need some medication. You might need surgery. You might need chiropractic care. You might need massage therapy. And so what we do is we try to put together a protocol designed specifically for you to get the best results that you can get, because it may not be just one treatment. And sometimes it's tricky. I teach my doctors and my interns that we're kind of like investigators. All right, we did this, we checked the stomach, we checked the spine, and now sometimes a foot bone is out of place. And if a foot bone is out of place, it can cause knee pain. If the knee pain is there, that can shift your hips out of place, and that can lead to chronic hip pain, which can then throw your neck out of place, which can cause headaches. So if you're just treating the headache, you're not maybe investigating everything you need to. Folks, got to go to break. If you have a healthcare question, 844-44-DR-JOE. That number rings through to my offices when I'm not on the air, 844-44-DR-JOE. The Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Love to have you come in as a patient. If you have healthcare questions, you can send them to me through the website. I'm more than happy to answer them. The supplements we've been talking about, all on the website, drjoe.com, also available on Amazon. Follow me on Facebook. Follow me on Instagram. Sign up for my newsletter on my website. We want to get all the information we can to help get you well and keep you well. Hey, don't go anywhere. We're going to be right back. Hey, folks, thanks for being here. I do appreciate you. If you're just joining us, welcome. If you stayed with us, thanks for staying with us. We're talking today about chronic pain patients and some weird places that pain can be coming from. For example, we had a patient not long ago. She had endometriosis. Endometriosis is when the tissue in the uterus starts to grow outside the uterus. It's a simple explanation there. And so she had endometriosis, and then she started developing shoulder pain. And we did a chiropractic workup on her. Nothing really was showing up too major. We said, well, she got a pinched nerve here. Shoulder might be out of place. We worked on it, did some trigger point work. But then we got her diet straightened out. We got her diet cleaned up, and the endometriosis seemed to calm down. We put her on a really alkaline-based diet, a lot of fruits and vegetables, nuts and seeds. We do a cleanse at the office. We can do a cleanse if you want to get the body cleaned up. Maybe you did a lot of medications in your life or drugs. We've had some drug addicts come in, and they want to clean themselves up. And also a good way to kind of jumpstart a weight loss program. We do a cleanse, and we have a whole program with supplements and everything. And if you want information on that, you can just come into our office or call us. And once we got her on the cleanse and got her body straightened out, shoulder pain went away. So the endometriosis was reflexing up into the shoulder, and it can certainly be related to that. And that's why you can't just ignore, one thing and say, okay, ignore everything else. I'm sorry, I got shoulder pain. I'm just going to treat the shoulder. It could be coming from somewhere else, which ties in nicely to our next caller. David, how can we make your day better?
Yes, sir. I'm on concrete all day, and after my second visit to a podiatrist, he has told me that I need metatarsal, some kind of a surgery where they split the toe open. I have hammer toe on my second toe in.
Sure.
Can chiropractic care help that?
It depends how bad it is. It's interesting because a very good friend of mine, unfortunately, died of a heart attack, Eric. He was a podiatrist, and then he started studying chiropractic and got so excited, it started making sense. He also became a chiropractor. And 1/4 of all the bones in your body are in your feet. So if one of those bones comes out of place, that can shift everything out of place, and that can start, obviously bones are out of place if you're developing hammer toes. So we would get in there and try to manipulate or adjust the bones as the best we could. Now, here's the thing on that. If we fix it, awesome. But you want to get as healthy as you can if you need the surgery going into the surgery so that you've got the best chance of coming out of the surgery with less complications. So a lot of surgeons... so the surgeons, podiatrists, they'll send patients to us knowing that we're not going to fix the problem, but at least get the person healthy so you have a much better result overall. So I'd certainly recommend giving it a shot and see what happens, and if not, then we can always go to the next step.
Yeah, okay. Well, it's kind of scary when you look at the surgery.
Yeah.
What they do.
Yeah, it is.
Taking out a section of bone.
Yeah, that is. Ooh, yeah, but I would certainly try everything, and that's always my theory. Try the most conservative things first, and if that doesn't work, we can always go to a more aggressive technique. But once they cut your foot open, your foot's cut open. That's a forever. So.
Yes, and nerve damage and all that stuff,
there
too.
you go. Yep, that happens sometimes, too. And if they don't put the bones back together just right, it throws your gait off. You're walking, and that can throw your knee off, which can throw your hips off, and... yeah, feet are really important. We do a lot of work with feet in our offices, and we get usually amazing results. So,
oh, great. Well, thank you very much. I appreciate this.
Thanks, David. Thanks for the call. Yeah, folks, if you do want to come see us, offices in Marietta, Duluth, and Stockbridge, drjoe.com, or the number you're calling with your questions, 844-44-DR-JOE. And if you have questions, we have a few lines open. We can get you in maybe today. So we're talking today about chronic pain patients and how you really got to start looking not just where the pain is, but where the source of the pain might be. So if you have numbness in your hands or carpal tunnel syndrome, I remember years ago, carpal tunnel syndrome was all the rage. Everybody was getting carpal tunnel surgery. And then patients, after a while, started coming to us and saying, well, Dr. Joe, it didn't help. Well, the problem was they had a pinched nerve in their neck, which was affecting what's called the median nerve in your wrist, and that's where they're having wrist pain. The problem was coming from the neck, not the wrist. What's some signs of heart attack? Shoulder pain, arm pain. It's not even in the heart, not even in the chest. So you may have referred pain. If you have pain in your right shoulder, I always talk to the patient about gallbladder issues because gallbladder pain can refer up into the shoulder. So we want to try to check and see what else is going on. It may not be what you think it is. There's also a gut connection to pain. If you have something called leaky gut syndrome, what this is your colon it is where nutrients are absorbed. And in some places in your colon, the colon is only one cell thick. One cell. So if you're eating bad foods, if you have an inflammatory diet, meats, butters, cheese, yogurt, ice cream, eggs, and this causes an inflammatory reaction in the gut, it can actually tear holes in the gut. And these big chunks of undigested food can be absorbed into the body, into the blood system, causing an inflammatory reaction that goes systemic, which meaning through your whole system. So oftentimes when we have a patient come in who's in pain, of course, we want to check the spine and the bones and the feet and the knees and the ankles. But we also want to do a nutritional workup on them because if there's a nutritional component that's not being diagnosed, well, you're not going to get the results that you want. And even if you had the best chiropractic care in the world, well, if you have a leaky gut syndrome, you may not be getting to the cause of the problem either. People come in sometimes with what's called herpetic neuralgia from a herpes virus. Let's assume it's shingles. We were talking about that last night with some friends of mine. And that can cause some devastating pain. So if we have a herpes infection, whether it's genital, oral, if it's shingles, and most people, by the way, are infected with one of the herpes viruses. There's a ton of herpes viruses out there. You got to look at things that can cause the herpes virus to outbreak. And one of the things could be peanuts. Something as simple as peanuts. Peanuts are high in arginine. They're also high in what's called a mycotoxin, which is a fungus. And the fungus can cause a reaction in the gut. And the arginine can stimulate the herpes outbreaks. This is why many times you or someone you know may have outbreaks after doing something like going to a baseball game, going to the circus. What does a baseball game have to do with herpes outbreaks? Well, where do you eat peanuts a lot? You may not be a peanut eater until you go to the circus or you go to the ball game, and that can cause problems. So peanut butter and jelly sandwiches may not be the best thing for you if you have post-herpetic lesions. So maybe you can do an almond butter sandwich or a cashew butter sandwich. Now, I'd prefer you don't do the bread anyway. But if you, instead of peanut butter, try almond butter, try cashew butter. I'm going to tell you not to try cashew butter because once you try it, you're going to fall in love with it, and it's expensive, but it is so good. So you can do cashew butter, almond butter, hazelnut butter. So maybe stay away from the peanuts. And I'm not a big fan of peanuts anyway because many times they cause an inflammatory reaction because they have these mycotoxins on them. Valencia peanuts don't seem to have the mycotoxins, but the other peanuts do. So if you're going to do peanuts, make sure they're organic, but I prefer you stay away from them anyway because they grow underground and mold can grow on there, and that becomes a problem. So that's an issue. We talk about foot pain. I've got to cover that too. We just kind of did a little bit with the last caller, but foot pain, many times we have to go in and adjust the feet. And that's how I was talking about my friend Eric, rest his soul, that he became so excited when he learned about chiropractic, he incorporated it into his podiatry practice. And he was the best. He was just brilliant, this guy. And he'd go in and adjust the foot and the knees and the ankle. He'd check the muscles. He'd do applied kinesiology. I taught him a lot of these techniques. He actually practiced in my practice when he was going to school. And then after he graduated, we were still friends up till the day he died. But brilliant work. And I learned so much from him as well that you can work on things like the feet and the knees and the ankles, and that helps balance everything else out. Folks, I'm Dr. Joe Esposito. Got to go to a break. We're talking about chronic pain patients, things you can do to get them in control. Hey, follow me on Facebook. Follow me on Instagram. I just saw a bunch of you did. Thank you so much for doing that. Sign up for my newsletter. It's on the website, drjoe.com. The supplements we talk about, all on the website, drjoe.com. Also available on Amazon if you have an Amazon account. We want to get you well and keep you well. If you have a question, give us a call, 844-44-DR-JOE. We'll be right back. 44-DR-JOE. We'll be right back. Hey, folks, thanks for being here. Do appreciate you staying with us. If you're just joining us, welcome. Glad you could be here. Talking today about chronic pain patients and what do we do for chronic pain patients. And this is interesting. I want to cover this real quick, and then, Rhonda, if you're on hold, I'm going to get to you in just a second. American College of Physicians has released an updated guidelines for non-invasive treatment of non-radicular, subacute, acute, and chronic low back pain in primary care. You got problems. The guidelines were updated in the Annals of Internal Medicine. Overall, new guidelines emphasize conservative treatment. First-line therapy should include non-drug therapies. Now, once again, this is from the American College of Physicians saying that we should be doing non-drug therapies first for pain intervention. One of the major insurance companies just went to the Georgia Chiropractic Association and had a meeting with them, and they said, we want to start referring our pain patients to chiropractors first because we now realize, finally, that chiropractic care is less expensive and more effective with less downtime for most back pain patients. Well, yeah, we've been telling you this for 120 years now. You're finally understanding it? And I never understood it because insurance companies save money when they go to non-invasive, non-drug treatments first overall. Sometimes you need the drugs, sometimes you need the surgery. But finally, the American College of Physicians is getting it. Treatment of low back pain, clinicians should select therapies with the fewest harms and the lowest costs. I'm amazed that we have to do a study to come up with that. Fewest harms, lowest cost. That makes sense. Clinicians should avoid prescribing costly therapies. Some of those have substantial harm, such as long-term opioids. Pharmacological therapies were not shown to be effective and oftentimes led to chronic problems in many cases. So I always say chiropractic first, drugs second, surgery last. Makes sense. That's why I'm a chiropractor, and I was going to be a neurosurgeon, but I got so excited about chiropractic and natural health care, which then led me into nutrition, which led me to helping you guys on radio. Let's take another caller. Rhonda, how can we make your day better?
Hi, Dr. Joe.
Go ahead.
Can you hear me?
I can hear you fine. Yes, ma'am.
Okay. I have two questions. One, I've had a history of numerous injuries to my right foot. One includes a fractured ankle compound where I have steel screws and rods. I have 4 broken metatarsals, and I also have a bunion on my foot.
Right.
My orthopedic doctor says that I either need to have a fusion or I need to have an ankle replacement.
Okay.
Can chiropractic care help before I have to have surgery? And would that help with the bunion? Can you do anything with the broken metatarsals? And then a second question is, I've also had the lap band surgery done.
Uh-huh.
And I hear you talk on the radio a lot about having your stomach pulled down.
Yep.
Can you do that with a lap band?
Yes. I've worked with many people with lap bands. My doctors, we can all work with that. That's never been a problem in the past. As far as the fractures, yes, I have 2 fractures in my spine. I broke my wrist twice, actually, too, and I get chiropractic care all the time. So once a fracture's healed, there's absolutely no problem getting chiropractic care in most cases. For the bunions, the reason you develop the bunions is because the bones are out of place. So I would certainly try to get the bones back in place. The problem is if the bones have changed their shape, which, depending how bad the bunion is, we may not get 100% results. But you want to get it as straight as possible, regardless of what else happens. And we've had bunion cases that were suggested for surgery, and once we worked on them, they didn't need the surgery anymore.
Yeah, I'm actually walking on the actual side of my big toe.
Yeah.
And I have to wear what they call an ASO brace on that ankle.
Sure.
So I have lots of problems with that one foot.
Certainly worth a shot. If it doesn't work, doesn't work. But it's safe, safe and effective. And that, even like the American College of Physicians is saying, let's try the safe, non-invasive approaches first, and then we can build up from there. So everybody's in agreement. Let's do it.
What would be a time frame that you would give that trying it before you actually had to do surgery? Because I've been on Mobic for arthritis for years, and it's ineffective anymore.
I would give it about 8 to 10 weeks of treatment, and if it doesn't work, we can move on from there.
Okay. Well, I appreciate your help and your thanks. Thank you.
Thanks, Rhonda. I appreciate it. And, folks, if you do want to make an appointment, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. Just go to our website, drjoe.com, or 844-44-DR-JOE, and you can make an appointment, and we would love to see you. And it's interesting because I got to get on my bandwagon with insurances now, and it's starting to swing the other way, by the way. The insurance companies, I hope the insanity has bottomed out. It looks like, from what I'm hearing and what I'm seeing, the insanity of insurance companies just denying everything is starting to change, and the pendulum's starting to swing the other way. But don't let the insurance companies dictate your health care. They are not doctors. They're trying to save money. So if you're going to let an insurance company dictate what you can and can't do, that's not good advice when it comes to health care. Now, finances are an issue. I get that. But insurance companies, you have these outrageous premiums. You have these incredible deductibles, outrageous copays. How about you just get better? That's kind of a much better approach. And so hopefully the pendulum's swinging the other way. I just don't want it to be too late for you. We accept most insurances. Most doctors, by the way, if they don't accept insurance, is because the insurance company wasn't paying them enough to keep accepting patients. We've dropped out of a few, I think 2 plans, because the insurance companies weren't paying us enough. We couldn't afford to see you. We have overhead too. And so many times, if you just look at the deductibles and the copays, it's going to be more many times than the doctor is going to charge you anyway. So don't let that happen. I know finances are an issue, but talk to your doctors, talk to us, and let's see what we can do to get you under care. But we accept most insurances. If you've ever been in a car accident, ever, if the car was damaged, you were damaged. 100% of the time. Again, I don't care what the insurance company says. They are not experts in healthcare. They're experts in, well, they're not experts, except saving money is all they're trying to do. But come see the doctor and make sure you're getting it done right. All right, back to this whole thing, the guidelines from the American College of Physicians. Before I run out of time, I want to cover this. Up to 30% of patients report persistent back pain after 1 year of experiencing an acute episode. Studies show that chiropractic care is the least expensive, most effective treatment for most neck and back pain cases. And there's study after study on that, workers' comp cases, everything. First-line therapy should include a non-drug therapy, including heat, massage, acupuncture, and chiropractic care. So once again, we'll put that in the Dr. Joe was right column. And there's a lot of side effects of medication, and that's what we're finally seeing now, that we've been prescribing these opioids. People are dying from it. You see the commercials now on TV, people hurting themselves, breaking their own hands, getting in car accidents just to get more opioids. And I've done shows on opioids before. If you go to my website, drjoe.com, we have hundreds of hours of podcasts there, audio and video. So follow me on Facebook, follow me on Instagram, sign up for my newsletter on my website, subscribe to my YouTube channel. We're putting a lot of videos out, by the way, folks. We're going to put out a video a week coming up very soon. That should start in about a week or two. So you don't want to miss that. Hey, listen, folks, if you missed a show, if you're just tuning in, you missed a great show, it's going to be on the website. If you want to get the Super Greens, the Essential Source, the other supplements, the vitamin D, they're all on the website, drjoe.com, or just Google Dr. Joe. If you want to make an appointment to come see us, we would love to be your doctors. We'd love the opportunity to work with you from a chiropractic standpoint, a nutrition standpoint, and a digestive standpoint. So just go to website, drjoe.com. Hey, folks, if I don't say it enough, thank you so much for tuning in. Thanks for making us the #1 health and wellness radio broadcast in the country. We'll catch you soon.